years ago, the idea of prescribed, purposeful exercise to help cardiac patients recover from heart attacks, bypass surgery, and other cardiac events was still a bit of a novel idea to many in central New Hampshire. Over the last decade and 500 patients later, Speare Memorial Hospital's Cardiac Rehabilitation Program, or Cardiac Rehab, has worked to change that, building better hearts, one patient at a time.
Prior to my heart attack, I was not an exercise person in any way, shape, or form. Overall, the cardiac program has saved my life.
Introduced as a new service at Speare on October 24, 2005, Cardiac Rehab was developed to meet the community need of having follow-up cardiac care close to home. Today, in collaboration with the visiting cardiologist from Catholic Medical Center, the full continuum of care is available right here at Speare.
Well, I do live close by. I'm only 5 miles from Speare Hospital, but a lot of people live out in the country here, so it can be very difficult to get to a program, because it does make it easier to assess the rehab program, whereas you'd have to go all the way down to Manchester or Concord possibly. So we do have an advantage in our community to have this program.
My name is Craig Johnson. I'm an exercise physiologist at the Cardiac Rehab Program at Speare Memorial Hospital.
I'm Rachel Kindle. I'm also an exercise physiologist in cardiac rehab at Speare Hospital.
So we are celebrating 10 years of cardiac rehab services at Speare Hospital. We started the program back in 2005 because really of a community need, and the addition to the hospital, the cardiac rehab program was built. So we have graduated about 500 people through the program in the last 10 years. And the biggest benefit of the program is our relationship with Catholic Medical Center Cardiology at New England Heart Institute.
Because of our relationship with CMC, we oftentimes have the patient's information before they're even discharged from the hospital, after their stent or bypass, heart attack, whatever it may be. We oftentimes see people in our stress lab, which go down to Catholic Medical Center because of an issue they're having. 10 years ago when the program started, cardiac rehab was not well known, but through word of mouth and people talking with their neighbors and finding friends in stores and the senior center and things like that, cardiac rehab has now become more popular, and it's actually become more of a staple in their recovery.
The prescribed cardiac rehab program is a combination of exercise and education over 36 sessions, meeting in the cardiac rehab gym 3 times a week.
So the typical cardiac rehab program is going to run anywhere from 24 to 36 sessions. We meet every Monday, Wednesdays, and Fridays. Back in 2010, there was a major change with insurance companies that they realized that cardiac rehab was not just exercise to get you back to your normal everyday lifestyle. They also think that the education with dealing with heart disease is important, so they require an education piece. And here we do 12 different education topics that deal with reducing your risk for developing further heart disease.
I listened to the 2 people that are in rehab and who were fantastic. And then the program here, which was a combination, not only them, because there was education every day, and it was amazing.
Changing patient behaviors is the main goal of cardiac rehab, and the patients are getting younger.
So interesting, over the last 10 years, the average patient's age has decreased. Now we're seeing a lot more younger patients coming in with heart problems, ages 30s, 40s, low 50s now. Back 10 years ago, we could probably say our average age was about 60 to 72-ish.
The lifestyle that a lot of people lead now is not very healthy. Lots of fast food, poor diet. A lot of people don't get as much exercise as they should. We tell our patients to shoot for 150 minutes of moderate exercise per week. That would mean getting your heart rate up, breathing a little bit harder. If you can do that, you're really going to have an impact on your health.
Speare's Cardiac Rehab Program became nationally certified by the American Association of Cardiovascular and Pulmonary Rehabilitation in 2013. This certification recognizes Speare's Cardiac Rehab program as a national leader in cardiovascular and pulmonary rehabilitation for offering the most advanced practices available and our commitment to improving the quality of life of our patients by enhancing standards of care.
I'm very excited about life and what it takes to make each day a positive, wonderful experience. And I have to admit that Speare Memorial Cardiac Rehab was very important on my road to feeling this way.